Welcome back. Fox Carolina is committed to you, and it's why when This Week Doctor said Welcome back. Fox Carolina is committed to you, and it's why when This Week Doctor said all kids should be screened for heart problems, well, we wanted to find out more about these guidelines to help keep you and your family safe. A lot of folks around here have kids as well. So these updated guidelines from the American Academy of Pediatrics say the screenings can detect and prevent sudden cardiac death.
Fox Carolina's Brooklyn Crilmer talked to a local pediatrician and a family impacted by this condition. She joins us live with more.
Well, I did some digging and found an alarming number, 4,000. That's the number of children and young adults who die from this condition every year. Now, doctors say it's completely treatable, but often goes undetected until it's too late. Melissa Russum says her sister was a seemingly healthy 24-year-old until a trip to the dentist changed her life.
She was perfectly healthy that day, complained of a toothache, and actually was in the doctor's office going for the tooth pain at the time of her cardiac arrest and was not able to be revived.
From the outside, Christy Tolsky was the picture of health, but an undetected heart condition suddenly ended her life.
Not at all the person you would think of as having a heart condition, and certainly not having a fatal heart condition.
Following her sister's death, her family learned she had long QT syndrome. Russum later found out she, her mom, and her 2 daughters have the same condition. They easily manage their condition with medication, but if left untreated, it can lead to sudden, unexpected death.
You know, my sister experienced fainting spells in college in her dorm room, in high school when the bell went off to change classes.
I took a closer look at new guidelines from the American Academy of Pediatrics. Doctors say all kids should be screened for heart conditions every 3 years. We asked a pediatric cardiologist with Prisma Health how the screening works.
They're likely to ask your child if they've ever had chest pain or shortness of breath, particularly when they're exercising. They're likely to ask if they've ever passed out or lost consciousness, things like that would be a red flag that maybe they need further screening.
Now, according to the SADS Foundation, which advocates for patients diagnosed with heart conditions, children and young people who die from sudden cardiac death usually seem healthy, vital, and normal. Now, if untreated, it can be deadly, but if detected, these conditions are absolutely treatable. If you'd like to find out more about the SADS Foundation or prevention and treatment options, we have a link posted in our As Seen On section on foxcarolina.com.